Okay, hello again. I hope you miss me. So in this chapter, I'm gonna be reading the chapter six, and I'm gonna be reading in English, then translating into Spanish, and the exercises I'm just gonna be reading in English. So if you see me with the book, it's because it's more comfortable for me just reading from this place. Okay. Let's start. 6. Medical practitioners. 2. A. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of the four main groups. The first is a pre-registration house officer or house officer. Is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner in the current system of training. The foundation program, the name for this junior doctors is Foundation Year 1 Doctor. See Unit 12. 2. A senior house officer (HAO) is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor. With the old terms senior house officer and HAO are still used. 3. A specialist registrar is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-trained registrars, doctors who have completed their training but don't know which to specialize yet. And the fourth is a consultant. It's a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Okay, now with the B. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors, but also physiotherapists and other allied health professionals. Okay. When patients enter or are admitted to hospital, they are usually sent first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctors clears them. They takes their medical history and examines them. Sometime later, the registrar also sees the patients in main order investigations or tests. For example, X-ray or an ECG make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions people who present living admitted to to the ward for the first time on one of the regular ward rounds. When the management of the patient is discussed with the register, consultants also decide when a patient is ready to be discharged, sent home. On the war room, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. C. C. Shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. At the next day. After a week, they change to different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and take the turns to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 p.m. 9 a.m. Sorry. The next day, dates on call are set out in a rota or list of names and times doctors On call carry a radio pager or a bleeper, a device which makes a noise when someone is trying to contact them. Okay, now I'm gonna be translating into Spanish. I'm so sorry for the crocus. It just doesn't shut. Sorry. Okay, six. Perdón, seis. Médicos practicantes 2. Personal hospitalario. Las personas que trabajan en cualquier tipo de lugar de trabajo, incluido en los hospitales, se denominan personal. El personal médico de un hospital británico pertenece a uno de los cuatro grupos o ramas principales. Bueno, grupos principales realmente. Ok. Un médico residente de prescripción o PRHO o médico residente es un médico recién graduado en el primer año de formación de posgrado. Después de un año se convierte en médico residente registrado en el sistema actual de formación, el programa de fundación. El nombre de estos médicos jóvenes es médico de fundación de año 1. Segundo, un médico residente junior o SHO está en el segundo año de formación de posgrado. El título ahora es médico de fundación de segundo año. Pero los antiguos términos como residente junior y SHO todavía se pueden utilizar o se utilizan. 3. Un médico residente especialista es un médico que ha completado el programa de fundación y se está formando en una de las especialidades médicas. También hay algunos médicos residentes sin formación que han completado su formación pero aún no desean especializarse. Un consultor es un especialista que está totalmente calificado. También pueden haber algunos especialistas asociados o médicos senior que no desean convertirse en consultores. Además, hay al menos un director médico o clínico que es responsable de todo el personal médico. B. Equipos médicos. Equipos médicos. Los médicos consultores y cirujanos son responsables de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médicos junior para ayudar a cuidar a esos pacientes. En muchos hospitales hay equipos multidisciplinarios que constan no solo de médicos, sino también de fisioterapeutas y otros profesionales de la salud. Ve a la unidad 8. Cuando los pacientes ingresan o son admitidos en el hospital, generalmente son vistos primeros por uno de los médicos residentes de la sala donde recibirán tratamiento y atención. El médico residente los atiende, toma su historial médico, ver las unidades 47-49 y los examina. Un tiempo después, el residente también ve a los pacientes y puede ordenar investigaciones o pruebas, por ejemplo, radiografías o un ecocardiograma, hacer un diagnóstico provisional y comenzar el tratamiento. El especialista generalmente ve a las personas de nuevo ingreso que han sido ingresadas recientemente en la sala por primera vez en una de las rondas regulares de la sala. Cuando se discute el manejo de los pacientes con el residente, los especialistas también deciden cuando un paciente está listo para ser dado de alta, enviado a casa, en la ronda de sala. El especialista está acompañado por el equipo y una enfermera y visitan a todos los pacientes bajo su cuidado. Y por último, las turnos. Los médicos jóvenes o los médicos junior ahora normalmente trabajan por turnos, lo que significa que normalmente trabajan 8 horas todos los días. Por ejemplo, de 7 de la mañana a 3 de la tarde y luego están libres hasta las 7 del día siguiente. Después de una semana cambian a un turno diferente, por ejemplo, de 3 de la tarde a 11 de la noche o de 11 de la noche a 7 de la mañana. El sistema alternativo es trabajar de 9 a 5 todos los días y turnarse para estar de guardia y estar disponible para regresar al hospital si es necesario. Eh, de, mm, de, de 5 a 9 del día siguiente. Los días de guardia se establecen en una rotación o lista de nombres y horarios. Los médicos de guardia llevan un buscapersonas o un beeper, que es un dispositivo que emite un ruido cuando alguien intenta contactarlos. Ok, muy bien. Ahora estaremos leyendo eh, los ejercicios y estos son sorry, we're gonna be reading the exercises and we're gonna be reading in English. Again, I'm gonna use my book because it's more comfortable for me. Okay, say 6.1. Make word combinations using a word from each box. Look at A, B, and C oppositive to help you. As associated specialist, provisional diagnosis, house officer, radio pager, on call, and war room. 6.2 match the descriptions 1 to 5 with the job titles. A. Look at A and B oppositive to help you. 1. 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. And it's the C. That is um, a consultant. Okay, 2. Dr. Stewart has just started the second year of her foundation program. Is the D? She's IHA. Okay. The third is Dr. Sin has started his training as a surgeon. Is the A? Is a specialist and register. 4 is Dr. Phil has his graduate and is working in a large hospital in Birmingham. Is the E? He's a previous or house officer. And the five is Dr. Miller is in charge of the medical staff in the Birmingham Hospital. Is the B is a medical director. Okay. 6.3. Are the following statements true or false? Find the reasons for you answer in A, B, and C or positive. Okay. 1. A medical graduate becomes registered 2 years after graduation. It is false. 2. The system of training doctors in Britain is called the Foundation Program. It is true. The third is um, the name senior house officer is no longer used in the Britain. It's false. You can use both. For the consultant is usually the first doctor to see the new patients. It's false. It's the resident. 5. When working in shift, all doctors they turns to be on call. No, not all doctors. The last is at 6.4. It is completed test of the PRHO describing her job. Look at A, B, and C positive to help you. Okay, I'm gonna read into this. When I get to the ward, the first thing I do is talk to the house officer who has on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous cleanliness to put on or take down. Later in the morning, I clear any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually a lot of things to do, like writing up requests forms for blood tests, and so on. In the afternoon, I have to prepare for any patient who are to be discharged the next day. They're usually happy to be going home. And then, of course, there are the lectures and the tutorials in the training program on Monday and Wednesday. Okay, so thank you for your attention. See you in the next chapter. Bye.